Beacon, a guiding or warning light. A pole used as a standard on the tops of mountains, as a call for the community to assemble themselves for a great national purpose. Southeast Michigan Beacon Community. Annual Report 2011.
Through the primary care physician community that we have engaged, we're touching well over 14,000 patients with diabetes. And if you take into account their larger patient panel, for all of those physicians, we're touching well over 150,000 patients through our efforts related to clinical transformation.
I see patients almost every day, and yesterday I was in practice. The patient came to see me, new patient. The patient brought me their records. This is what they handed me in my 20-minute visit. This is an example of the paper system that we currently have. Imagine if I were to have all of this information that the patient provided me in an electronic format from all their different health systems and providers. That's the thrill of the Beacon Project.
Beacon's a good opportunity to help improve diabetic care through the use of health information technology, and I'm encouraged about the opportunity for health information exchanges.
Well, it's very important for this community. I believe we have chronic disease epidemic in our city as we have in our nation, and if we're going to solve that, information technology is going to be a key part of that solution. It significantly helps us with chronic disease management and preventive health, and the way we're able to manage disease through having timely and appropriate information.
The idea behind clinical transformation is really to look at continuously improving the care that we give our patients, looking at ways we can do it better, both on an individual basis, but also in terms of population management. How can we do the best for every person in our practice?
I think that EMRs are really going to grow in popularity because the ease of use is going to be there, and because people are going to really see how well they integrate the rest of care. They bring the pictures in from the MRI. They send the information out to the physician office. They take the medical records from 4 different institutions and bring them into one view. That's really when acceptance is going to come, when it's no longer about my medical record, but it's about the patient's medical record.
My first contact with Southeast Community Beacon was through my Dr. Stephen Hadesman. When I went to visit with him first time, he told me that my diabetes was out of control, and he had a program that could help me get it under control.
The PHN program, or Patient Health Navigator program, is a program based on community health workers. These are people who aren't health educators, they're not nurses, they're peers of the patients who really work with the patients to help them improve their self-care. They help them identify what barriers they have to care, whether that's transportation or remembering their medications, and then they help the patient overcome those barriers so they're able to meet their care goals better.
Helping people like Glenda, the satisfaction that I get from this, I can't even describe it.
It's really going to change the way we look at our responsibility towards our patients, and hopefully change the way patients think about their responsibility towards their disease and health.
It's helped me to develop habits of watching my carbs and my calories, taking my steps, the fluid intake, taking my meds right. And so these are habits that help me live, and not something I'm trying to get away from. I'm staying in these habits, good habits, because of the Beacon program.
It has lessened the burden on me of trying to find some way in order for my patients to be able to treat their disease.
I think in 2011 we've seen tremendous progress here as a community. At a very macro level, we've set up a broad-based stakeholder governing structure to include all sorts of entities that are important to healthcare and healthcare reform in southeastern Michigan, from health systems to large employers, to universities, to physician organizations and others that are important in moving the bar in healthcare.
At this point, they've really exceeded my expectation, and that's why I think that in the long run, it's going to be something that's going to reshape how we treat these patients.
I'm thrilled with the seed we're sowing through the Beacon Project and the support that they are providing. It's critical for our community.
Thank you for helping me live. Thank you for giving me the tools, the education. Thank you for empowering me to make better decisions. Please don't let this program go away, and I pray that it reaches more people.
We're the Southeast Michigan Beacon Community.